Hi, this is Dr. Sherry Shabowski from Medical Education in Minutes. And we're wrapping up our series on Nezzy the Nephron. And today we're going to talk about what happens when Nezzy fails. Unfortunately, Nezzy the Nephron is vulnerable, and the kidneys can fail. Kidney failure is divided into three categories. Pre-renal is typically caused by low flow states, such as severe dehydration or blood loss. Post-renal causes are most likely to be due to obstruction. The intrinsic causes include glomerular disease, tubular disease, interstitial nephritis, and vascular disease. If you now understand what the kidney does, then whether you know it or not, you already have an understanding of what happens when it fails. So here are the kidney's functions. It maintains sodium and water balance, maintains electrolyte balance, rids the body of waste and toxins, maintains pH balance of the blood, maintains blood pressure, manages hypocalcemia, and monitors and responds to anemia. So when you have renal failure, the patients often suffer from volume overload. They have electrolyte imbalances, including hyperkalemia, hypocalcemia, and hyperphosphatemia. They can become anemic, and anemia is quite common. And they can suffer metabolic acidosis that cannot be compensated. Hemodialysis is a procedure that filters the blood of a person whose kidneys are no longer working properly. A machine filters waste, salts, and fluids from your body when your kidneys are no longer healthy enough to do that work adequately. Usually it's about 3 times a week and several hours a day. The patient is required to sit still for the whole procedure. To do the procedure requires an AV fistula if hemodialysis is to be maintained. The veins just simply cannot tolerate the high flow of dialysis so frequently. It can be done with a double lumen large central line short term, but that has its own problems. Those catheters are prone to infection, and it is a bit unsightly as well. This procedure is done in a dialysis center and consumes a large part of the person's day. Peritoneal dialysis is another option. Peritoneal dialysis uses the peritoneal membrane as a filter. Dialysate goes into the peritoneal cavity through a catheter in the abdominal wall. After about 4 to 6 hours for exchange, the fluid is allowed to flow out. This process is done daily, sometimes twice daily. It can take a great deal of time, but it can be done at home, and activities can continue while the dialysate is inside. All right, thanks for learning with me again. I really appreciate it. Please like, subscribe, and comment. Have a good day, and I'll see you next time.